All right. Hello, everybody. This is Dr. Shirlea North from North Star Physical Therapy again. And I'm super excited to be introducing today a guest, Dr. Kevin Ward, who's a local chiropractor. And we really had a passion to get out there with really collaboration between two different kind of practitioners for the same goal for clients. So I'm just going to let Dr. Ward give his little spiel and his little intro about him and his business and what kind of clients he treats and conditions he sees as the most common. And then we'll talk a little bit about how indeed PT and Kairos do collaborate. All right, take it away, Kevin.
All right, great. Well, that was a great introduction. I don't know if I can top the introduction that you already gave me, but my name is Kevin Ward. I'm a chiropractor. I have a practice in Fairfax, Virginia, Northern Virginia area. I've been in practice for 14 years. Our practice, the main thing we treat is non-surgical joint pain. So if there's a joint in the body, that's anywhere in the spine or anywhere there's a bend in the body, if that area is painful, that's potentially something we could work with. And we'll get into this, just like Dr. North said, but we collaborate with all our medical colleagues, including physical therapists, which is awesome. So we try to get people better as fast as possible and as few visits as possible and back to doing what they love. That's what we're all about.
Yeah, absolutely. And I feel that we have that common thing. And so I often tell folks within physical therapy, it might be a little bit of a longer process because both of us treat holistically, which is great. And within the physical therapy realm, we can really get into the other avenues of their wellness program too. So I often tell folks, I'm sure you do a similar thing too with your practice, that it may take a couple of sessions to figure out like the why, and sometimes like the root cause. Then we find, okay, what are those root causes? Fix those things. And that's like your symptoms. And then once we have symptom resolution, then we want to challenge the system to make sure we're building up resilience within your body. So when you're talking about joint pain, oftentimes there's also that soft tissue that's attached to it and everything. So especially within our specialty of pelvic health, I always tell folks, I'm sure you do the same thing too, like the pelvis is like the keystone of the body, and there's your spine, your hips, the sacrum, tailbone, all of that is interconnected. So to align the bones and everything together, and therefore then the soft tissue can then be fully optimized and can work in that way. That's how like I feel like Kairos and PTs really collab the best together. And there was one client that we recently had, Kevin, that was pregnant, and they presented with a lot of that pubic symphysis, or the front of your pelvis, had extreme pain there. And yeah, talk a little bit about how we collaborated there, just to give an example for folks.
Yeah, it's a great question. So this was a woman that was pregnant and having pain in that pubic symphysis area, which is the area at the front of the pelvic brim. There's a joint there and there's cartilage there. And during pregnancy, I'm sure a lot of you guys know this, your body releases a hormone that makes the soft tissues more pliable in preparation for the delivery, which is great for the delivery. Not so great for joint pain prior to delivery as that baby's getting bigger and putting more pressure on those joints. So one joint that can be affected is that pubic symphysis joint. From a chiropractic perspective, we can analyze the motion that is occurring at the adjacent joints, like SI joint, hip joint, lumbar spine, thoracic spine. And even though that problem at the pubic symphysis is a hypermobility problem, typically a lot of times we find these areas of adjacent hypomobility, or areas that are stiff and not moving as much as we'd like to see them. And then that pubic symphysis is making up the difference and getting chewed up and becoming painful and inflamed. So from a chiropractic perspective, we specialize in joint hypomobility, so we can find those joints that aren't moving well and we can get them moving well. Now, you're welcome to talk about your side of it, but definitely on that side of it, we need to do some things to stabilize that pubic symphysis, glute activation, pelvic floor activation, which is not something I'm going to do in my office. So maybe I can toss it over to you and you can talk about how you handle that.
Yeah, absolutely. And I think that's one thing I really wanted to like voice out to folks, that there is this common misconception that like Kairos and PT are like doing opposites of each other, or like we poo one another. And really that's not the case. Of course, are there a lot of bad eggs out there? Yes, but we're not one of those. And so that's where with this client, for as an example, we literally were like texting and emailing each other, hey, this is what I saw in my session. What do you think? Because this person was very pain dominant. So she was seeing both of us a little more frequently at first, and we could really tag team together. And my comfort level as a clinician is, yes, I do joint mobilizations to help with those hypomobile? Absolutely. But if it's more of a full-on adjustment, I'm going to send them to an expert, which is coming down the road. And so that way he can do his thing, and that will complement our treatment, and then also vice versa. So he got that joint moving, and now it's like, great. Now we're going to be able to stabilize it with, yes, those soft tissue things, the glutes, the muscles, all of that. And then also for her in particular, when we're working with a pregnant client, by 37 weeks, we want to make sure they're good to go, because that's a full-term pregnancy. So those tissues need to be flexible and strong. And so we go through a whole pregnancy program here at North Star, and then that leads into our postpartum program as well. So that really does help prepare the tissues, right? But you got to prepare the joints. The joints have to move. The baby has to come out, right? So we got to make sure we're preparing those joints. So I love to pair up with someone like a great chiropractor like yourself that can appreciate what PTs do, that we really do complement each other. And we're in Northern Virginia here. And so for those that are outside of the DC metro area, there are huge hospital-based systems that just feed each other. And there's the small businesses like ourselves that not only do we market to each other, but we really do meet and network and collaborate on clients. Because it's not so much of, oh, I want to get business, it's, oh, how can we help this person? Her ultimate goal was to have a pain-free delivery. And we were just talking before the podcast, and I think she had her baby. So we're very excited for her to come back for a postpartum program. And so if there is any continued discomfort as the healing process too. So I often see postpartum clients may also need potential joint adjustments there as well. So the peripartum population, so within pregnancy and then postpartum, I find is a really big specialty within this space. Are there other, especially because you were talking about like joint pain stuff, so there are other folks that you like often treat or really have like a passion to treat?
Yeah, it's a good question. So just since my mind is in postpartum right now, I'll talk about that a little bit. So a lot of times if these folks are nursing or lifting their babies a lot, they're still hypermobile because of that hormone I previously mentioned. So a lot of times they'll have thoracic pain, they'll have overactive traps. A lot of times we'll see some rib alignment issues. That would be like pain in your back to the side of your spine that can radiate to the anterior, the front, or the chest. We're all, as new parents, you're all in that hunched forward position all the time, holding the baby, nursing the baby, staring lovingly into that baby's eyes. So that can create a lot of
3 o'clock in the morning. We love that baby.
Yeah, just pushing through. So anyway, that is rib issues and thoracic spine issues for whatever reason is a little niche that I've carved out for myself that I'm comfortable working with. Again, we collaborate with PTs to work on stuff like diaphragmatic breathing and core stability and that sort of stuff. But if it is a rib alignment issue where they're having point pain next to the spine, or they're having that pain when they take a deep breath or they cough or they sneeze, or that radiating pain around to the front, that's something that I've had good success working with and I enjoy working with. And a lot of people have those problems just because of how we're always in that forward anterior carriage posture all the time.
Yeah. Oh, absolutely. And exactly piggybacking that, like pressure management. I can't ask somebody to breathe a certain way if we're not moving the ribs and that mid back. So it is really awesome to pair up with somebody that can get that moving for us so that we can keep it moving. And that pressure management is huge because oftentimes there's a urinary issue that may arise or a bowel difficulty that may arise, or maybe they did end up having a C-section for delivery. And there's a lot of soft tissue work that we need to get moving as well. So yeah, the peripartum population is definitely huge. I love the fact that when we talk about the term diastasis recti, you always hear that within the pregnant population, that's that separation of the abdominal muscle and the soft tissue. But that can happen in guys too. You get that good old beer belly in college and just never really went away. And then you have constipation on top of that. And there's a lot of pressure management issues, and they have these like big old barrel chested, flared out ribs. So like this stuff can happen in guys too. So I love to educate that. And we were talking about, I think, a potential other client with tailbone pain. Maybe you had a fall on the ice or something, and so I would imagine like you would be checking out the rest of the spine and the hips and all that and the tailbone itself. And we were discussing about, you do external, I do internal. That's also like a fun little collaboration that we do as well. So yeah, if there's like any other like example like that, that'd be a perfect client to collaborate with a chiro and a pelvic floor PT doing external versus internal. Cause yeah, sometimes we do need to kind of get internal with that tailbone a little bit. So not to scare anybody, but yes.
Yeah, well, first of all, I just want to say I feel a little attacked since you talked about the belly since college. I thought that was a direct insult.
The dad
Uh,
bod.
but anyway, I'll move on. I'll move on from that. I'll let down down. Yeah, so let's talk about tailbone pain. So the tailbone, you've got the sacrum, which is that big triangular bone at the bottom of the lumbar spine. And then at the very end of that sacrum, the lowest part of it, you've got a small bone called the coccyx, and there's a joint. I know you know all this, doctor. I'm just saying this for your audience, but what can happen is if you have a traumatic event, like it's typically a fall on your butt, you can fracture the tailbone or coccyx, or you can displace it. Either one can happen. So if it's not fracture, there are some things we can do on the chiropractic side externally, meaning we're not going internal with our exam, like not going into the, rectum or any orifices or anything like that. But there are some things we can do adjustment wise to correct it. And then I know you talked to me about this a little bit. Maybe you can talk about it a little more as far as what you can do I'm sure there's a lot you can do from a pelvic floor activation standpoint, because there's so many muscles that attach to that area, but also from that internal mobilization standpoint as well. But that is something, if you have tailbone pain, it can become a chronic issue. It feels like you can never sit without pain. This is like months or even years after the injury. So yeah, that can be something that really affects someone's activities of daily living. And there's not a lot of good answers for it outside of what we're talking about. So yeah, what on your side of the ball there, what do you do on those types of cases?
Yeah, absolutely. We piggyback a little bit of, was there anything external in the pelvic floor space and within the specialty? Yes, depending on the pelvis, there may be one or two access points to the pelvic floor muscles. So there are external musculature that we look at. And that's why a lot of us have toys and models and tools and things, because we need to access these muscles and soft tissues in a creative way, right? So it's like we can't do like massage doing kind of manual work on like your bicep in the same way as your pelvic floor muscles. And so I always have ongoing consent for all of my pelvic floor examinations, because I want to make sure I'm meeting them where they are mentally and emotionally as well. So that's why my sessions are up to an hour. So we're really able to take a lot of time with explanation, with showing before we do. So that way we're not causing a nervous response and know that guarding what happened. And that's not really a true picture of what's really going on. So if someone like had a fall and had tailbone pain there is no fracture or something like that. And yeah, I've gotten some adjustments maybe done, but there's still like this lingering thing, or they maybe were never asked, was there any connection with any like bowel symptoms or urinary symptoms or something, or sexual pain or pelvic pain. Maybe they just never made that connection until someone asked, like myself. And so one kind of collaboration thing that we've done here is like a pelvic floor screen. So what's been great is that like Kevin has that in his office, so that way he can screen out those folks to help with that collaboration. Like, all right, I did external adjustments. They're still having this symptom. What else can we do? But yeah, so there is external pelvic assessment, and internally, yes, that is a great way to access these muscles. And or the tailbone, like the coccyx, that tailbone itself is right by the rectum. And so sometimes someone can have a bowel, like a constipation kind of symptom, but and they can literally feel it, or they're sitting and they feel like they're sitting on a ball or something like that. And okay, what else is going on there? Oftentimes, though, I always get asked this, do I do Kegels? Do I do that activation? Oh, I'm leaking. You're like, then I'm weak. Not always necessarily the case. So Kegels definitely have their place. But for us in the DC metro area, especially with the advent of the recent political change, there's a lot of us that are super uptight and we often hold our tension in our shoulders, and that brings the fascia soft tissue up, and we hold that within our pelvic floor too. So oftentimes, Kevin, I have to down train a lot of people. So they might be like super, what we think is stiff, but then it's okay, if we did mobilizations, we did all these things, I'm still like super uptight. But when I get them to relax, either through different stretching or mindfulness or things like that, then we're able to there's the true picture of what's going on. If they have that tailbone pain, is it because that bony attachment is now displaced or in different spot, and the muscle that's attached is now shortened and do it? So we kind of work through, is it the bone, is it the muscle, the chicken or the egg? And so it's nice to collaborate with another provider that like works specifically on that alignment. So I'm like, okay, I know they're aligned, they're good to go. I'm like, so it must be like soft tissue stuff. And I do like complementary joint mobility if I know someone's been aligned and I'm just starting to get that symptom back. Okay, let's do a little bit more in my office, and then we keep going. So I love being able to collab with somebody that can be just another point of reference too. We're both solo practitioners within our practices, so we don't have another team member to throw that, but it's nice to have that specialty in two different areas, but again, for that common goal to reduce people's pain. Because pain can be, through the joint, it can be through the muscles, but then that nervous system is often a factor that we have to capture here in pelvic floor PT. That's part of our holistic approach. And so I do collaborate with health providers and behavioral health providers and sex therapists and things like that, so we can capture that piece of it, because our nervous system just completely integrates everywhere, but especially in the pelvic floor space, because it is, you were talking about those daily activity things. Everybody pees, poops, and has sex, and we want to make sure that it's all good.
Yeah. Yeah, no, it's great. And every time I talk to you, I learn something, which is great. So it's great to have that collaboration. And like the thing you said about Kegel exercises, I've actually been holding a sustained Kegel this entire podcast. So I just released it based on what you said. So it's good. But yeah, I think you probably hear this all the time, but I think Kegels, anytime anybody has an incontinence issue, they just start cranking out Kegels, and that's not always necessarily what should be done. Yeah, that's good. That's good to think about.
Absolutely. And I think for our pregnant clients out there, I think the Bradley method, it teaches them to do 10,000 Kegels. It's like, what in the world? Or those Zella chairs that a lot of practitioners are buying. So people would literally just sit and get electrically stimulated in their pelvic floor externally to mimic a Kegel. Are there people that helps? Yes. But for the people that are already uptight, that's going to make it even worse. So I think the technology is good. It's just the application is not so great. And for those of you that have any kind of pelvic pain, it's come to either Kevin or myself to let's try to figure out the root causes here.
Yeah, I actually hadn't heard about that chair. That's pretty wild. But yeah, it sounds like a good application would be if you need to get information out of someone or something like that, probably be a good use of that chair. Sounds like a torture device to me.
I'm I don't want to be doing that.
So what it's doing electrical stim to the area when you're in a seated position to force contraction. I guess that's what they're trying to do.
Correct. And so when we think of what are the activities that we're doing in a seated position, for those of us who pee or evacuate a bowel movement, we're in a seated position. And so those muscles need to relax. They don't need to contract. And it's causing a mix match there. And so, I think that, again, the technology is okay. It's just the application of it, but it's, of course, serving to that population and it's more of a passive treatment. Someone could just sit there and let it do its thing, but not really be actively involved in having that connection. So I often see clients that maybe have done that and it made their symptoms worse, or they still have their symptom in standing. Maybe they have a prolapse or something like that. And in sitting, it's fine. But once they stand up, once they sneeze or cough or something like that, wait a minute, I was doing the Kegels, but that's not necessarily the case all the time. So that's where internal assessments really help show a good light there. And that again can be for male or female pelvises too. Yeah, you guys aren't exempt from pelvic floor stuff. No one just asked and no one will respond. Yeah, you guys need to make sure we're doing okay. So that's where I'm opening up my doors a lot more to male clients because, you know, after a prostatectomy, or if anybody had like cancer radiation to the area, or they also have, you know, pelvic pain, they fall on their tailbone too. We were talking about the diastasis recti earlier. So guys can have these issues too, or constipation with low back pain. So maybe you were treating their low back pain and we do that little screen and they probably like, oh yeah, I'm not taking a shit as often as I should be, or it's really hard when I'm doing it. Yeah, come to a pelvic floor therapist and we'll talk about it.
Yeah, a lot of people, they don't think that could be a mechanical issue, but a lot of times it is, especially I'm sure you see a lot of people where all these other medical reasons have been ruled out, but there's so
Right.
many problems. Yeah, I fully get it.
Awesome. I won't take into it. I know Kevin and I, we have our full plate today, but I really do appreciate you coming on and just doing a quickie little collab podcast. But we really just want to get out there and just say, yes, practitioners do collaborate. And we are outside of the bigger hospital systems. And we do, yes, take the time to really care about our clients. And when we say we treat holistically, we really do. And we love to collaborate with other practitioners. We often are exchanging our cell phone numbers, our emails and stuff. Just give me one quickie. Hey, I did this with this person. What do you think? Emails and messages to one another because we want to have you achieve optimal health no matter how we do, but we're going to come together through our medical minds and our skill sets. And so chiropractors and PTs, and specifically pelvic floor PTs, do collaborate. They do come together. It's just a matter of your clinician finding that like-minded other clinician around the area. But I love when people come and they say, hey, I'm seeing such and so. Fantastic. And I immediately like jot it down and reach out to that person because I want to collab. We're not taking business. We're not taking clients from another. We just want the best outcome for each and every one of our clients. So again, Kevin, thank you so much for joining me today. And really, until next time, we might think of some other topics.
I really appreciate you having me. And I just want to say for the listeners, you really practice what you preach as far as the collaboration and reaching out. If you want a pelvic floor therapist that really has your best interest in mind, that has a good connection of local providers to work with to get you the best possible result, definitely reach out to Dr. North. She's awesome. So appreciate it. Appreciate the time.
Awesome. Have a good day. Thanks, Kevin.
Yep. We're good.